In this episode, I bring on guest Dr. Manan Shah from WYNDLY, a telehealth allergy treatment center. And he has found a way to get access to all 50 states and helping all of us who suffer from severe environmental allergies. I myself talk about all the time how I've toned down a lot of my issues with vitamin C, but that's not saying that there isn't inflammation still going around my body, which Dr. Shah explains. And just like in food allergies, there is a thing called immunotherapy, which involves small daily doses or microdoses of these allergens under the tongue, straight to your mailbox. And this can all be done in a week. So if you're interested, stay tuned. How's it going? I'm Brad Williams, personal trainer and host of Over 40 Fitness Hacks, the podcast where I help you being over 40 to fight the aging process without giving up your social life. I've been a personal trainer and gym owner for over 15 years, and I've seen it all. If any of you in the audience need a little bit of help, I always put the link in my show notes for a free 15-minute consultation just to see if I can't point you in the right direction. Other than that, thank you for listening. I also have links to my Facebook group and a link to my favorite fitness tracker, which I talk about all the time, the Whoop 4.0. I think every single person should at least use it for a little bit to really gauge how many calories you're actually burning. But that's just me. All those are in the show notes. Let's get on with the episode. Dr. Shah, I just want to thank you for joining us and my over 40 audience here on my podcast. And my audience always knows we like to get to know you. How'd you get into environmental allergies? How did you start with your company, WYNDLY? I don't know how far back you want to go, but I'll let you take it away.
Yeah. So one, thanks so much for being here. I'm 39, so I'm about to become part of the same crowd that you appeal to. And these are all things I'm thinking about. And I think all of us at this age are thinking about how do we sleep better, breathe better, feel better, and just live better. And that's sort of our focus here at WYNDLY. So I'm a board certified ear, nose, throat surgeon. What that means is I'm a head and neck surgeon that operates on the nasal airways, the upper airways, the trachea, and of course we do trachs and scary things like that too. But our focus is on helping people breathe better so they can sleep better, live better, and recover better. And as I was doing my practice, of course I love surgery, right? You always want to figure out what is the root cause. And the root cause of a lot of people's trouble breathing is the allergies. And so a lot of ENTs focus on environmental allergies because 8 million Americans suffer from environmental allergies. That means 1 in 4 Americans, everybody knows somebody with allergies, and it causes inflammation in your nose and it makes it hard for you to breathe through your nose, which then affects the way you sleep at night. It affects your overall health and it affects your recovery if you're exercising, working out. So for us, it was such a big problem that we thought we could solve. And we realized through WYNDLY, which was our startup, that we could actually help people completely via telehealth, right? During the pandemic, people realized that care could be done virtually. And we realized we could make it super easy. You could basically meet with one of our doctors online. We could send you a test kit either at a local lab or straight to your house. And then based on those results, you could work with our physicians totally virtually. And we could prescribe you a customized therapy. We call it sublingual immunotherapy. It's basically exposure therapy. We give you a small dose of what you're allergic to. And over time, as you get that exposure, you become desensitized to your allergies. And the top line is that helps you breathe better, helps you sleep better, and helps you feel better.
Yeah, I have a lot of food allergy issues. And that's the new thing coming out too, is small microdosing, exactly what you're saying, to try to tolerate it a little bit better. I don't know if there's ever a full cure because your body's tagged it. And all through my life, I've had asthma when I was young. Thank God I grew out of that. But environmental allergies like crazy. And to where the point, like all my doctors, when they've done the blood test, they've never seen a report hit that many red flags on all these things. So I've definitely gone through that. What's nice though is like telehealth, like you mentioned, post-COVID, we really got used to it. But all these different companies such as yourself and others that I've found, even though you have like medical insurance, just going through what they make you go through to talk to your doctor to get the referral, paying cash out of pocket to certain companies that can get straight to the point almost ends up being the same price and also better care. So in my mind, WYNDLY's got something going on.
Yeah. And so we have a physical office here in Denver, which is where I live. But we realized that with virtual, we could literally make it cheaper for patients and easier than if they went and did shots in the office, right? The traditional method for treating allergies is to do what's called an allergy shot. You go in, you get an injection once a week. It's for 3 to 5 years. It's a great treatment. It works very well for some patients and it is covered by insurance, but not everyone has the time to get a weekly injection and sit there for 30 minutes in the waiting room and then another 30 minutes after the shot and those things. And so we realized we could make it literally cheaper for you. We could save you the copays in the doctor's office. We could charge less than your deductible usually is with your health insurance. and just make it transparent at $99 a month. And our patients have loved that. And then because we're outside of insurance, we can give patients the kind of care we want to give them. So our visits are not rushed. It's not like at the doctor's office where the doctor has like 6 minutes to be with you because your insurance company pays them for 3. No, we have time to work with our patients and figure out what's going on, listen to them, and really optimize their health so they can feel better.
Yeah. And you're allowed to work nationally, globally. You don't have to work specifically in your state. Because I know a lot of doctors,
Yeah.
even private practices, still have to abide by those laws, which kind
Yeah.
of sucks.
So one, we absolutely have to abide by the state medical board laws. You have to be licensed in the state where the patient is residing to
Mhm.
be able to provide them care or do a prescription medication, which this is. And we're super lucky that we went through a large startup accelerator called Y Combinator. It's a big one. They've made companies like Allergy and DoorDash and Coinbase. These are huge companies. And they were able to help us navigate all the legal regulations that probably, honestly, as a doctor, I wouldn't have known. And because of that, we are able to practice in all 50 states and work with patients across the nation. We have a number of physicians who are licensed in every state. And it's just been a really awesome experience because some patients just don't have an allergist near them, or some patients don't have time to go see an allergist. And we're able to see patients from their work. Literally, patients will do Zoom visits with us in the car while they're waiting to pick up their kid. Like, we make it as convenient as possible for you to breathe better and feel better. And we give you permanent allergy relief, which is something that you just can't get. And you don't have to do a bunch of shots. It's a really cool experience.
Yeah. And that's the thing, what I'm struggling with on the food allergy side. I'm sure for people going through their insurance, it's the same with environmental as well. But just to talk to an allergist took me 3 months just to get a telehealth from them.
Yep.
And then on top of that, they're going to do the little back prick test on my back. And that is like 3 months out too. So it's like, God, it just, the system is just terrible.
And what I would say is, look, my colleagues are all great people. And I think that they are just being constrained by the constraints put on them by the large healthcare insurance companies. What we realize is by stepping out of those healthcare insurance companies, we could just give the kind of care we actually want to give to patients. And so the benefit of WYNDLY is, like, you can see a doctor next week. You can go online, you can sign up, and we'll chat with you right away. You're not waiting. There's no gatekeeper. You don't have to get a 50 needle skin prick test. That skin prick test, the reason that it's done is that's what's reimbursed by insurance. And the more times you're stuck, the higher the reimbursement. And so some people just don't want to get 50 needles in their back. And so we offer blood testing. We work with the patients the way they are. Now, if you've had a skin prick test, we'll still work with you as well. But our job is to figure out what your allergies are. And we don't care how we figure it out. We want to get the right data so we can treat you the right way and help you feel better.
Awesome. That's great. So all 50 states, less than a week to get seen by someone. That sounds great. Dr. Shah, let's get into the science of environmental allergies. I don't know how crazy you want to get into genetics or family history. First of all, why are so many Americans? Then why is it someone like in my family, all the guys have environmental allergies and none of the girls have it? We all eat the same thing. We're all living in the same spot. Like, why are we getting picked on? Like, what's going on?
Yeah. So allergies are a combination of a genetic predisposition and an environmental exposure. Let's first start with how allergies work. So when you're young, your immune system is naive, meaning it doesn't know what's good or bad. When you're born, your immune system is like, I don't know what anything is, let me learn. And when you're a child, your body is learning like what is worrisome and what is not. And so unfortunately, the way we live today in Western society, we're not exposed to nature the same way we used to be. And there are studies that showed this, where kids who live in rural environments have a decreased level of allergies than kids who live in urban environment allergies. Wow. And so what's happening is, because your body isn't getting that exposure to nature when you're young, your immune system never learns what is good and what's bad. And really crazy things happen. I mean, there are literally tons of Americans who are allergic to grass and trees. And never in the history of humankind has there been a time when humans have not lived near grass and trees. We should not think of those as bad things. But what happens is your immune system overreacts. And so what we focus on at WYNDLY, it's just a way of re-exposing your body. It's like, what if you could go back and just take a little bit of nature every day for an extended period of time? What if we could retrain your immune system? That's what we do. So your listeners, a lot of them are spending time training their body, right? We used to spend a lot of time doing manual labor. Now we don't, because we all sit at desks at computers. But your listeners are spending the time in the gym to give their body that exposure they need to physical activity. And what we offer them is a way for them to give that exposure to their immune system, so their immune system can function appropriately. And that's what immunotherapy is, whether you do it via shots or whether you do it with us via drops. But we just want to make it something you can do in the easiest possible manner.
I just know from growing up with all these allergies and everything, you only know the big ones. I was always allergic to grass, mold, dust mites. And then I took various drugs, Claritin, all that kind of stuff. And I always said to my dad was in the medical field and pushed me into those kind of things. And it always gave me like a 5 to 10% edge, but it never cured it. And my thing was, I don't want to take all this stuff if it's not going to give me the max benefit for it. So I
Yeah.
just stayed away from a lot of those things. Do you think any of the environmental allergies, do you think any of them could be stemmed from our diet, or it's just 100% the environment we're in?
I think it's a combination, right? Everything that you put in your body affects the way your body responds. I think one thing that's really interesting is, like you were saying, right? You didn't want to take antihistamines because they work for like 5 or 6 hours and then they're gone. And then the question is, do you want to take a drug like that actually, like, I mean, it sedates you, right? When you look
Yeah.
at these antihistamine boxes, you're not supposed to operate heavy machinery because they cross the blood-brain barrier. And so a lot of my patients, they're not interested in taking a drug every day. They want to look for permanent relief. And that's what we offer them, right? Instead of just masking the symptoms with medications, we give your body the opportunity to learn how to respond in an appropriate manner. And that is what gives you this permanent relief. So for immunotherapy, what we do, the drops, and for our listeners, I'm holding up one of the bottles here. It's a blue bottle with a little pumper, and you take it under your tongue, just a couple drops every day. That immunotherapy, most people take it for about 3 years. And there are clinical studies that show that patients tend to show benefits for at least 8 years. And we assume it's actually lifetime. It's hard to do a study where you treat people for 3 years and then you follow them for another 8 years. After that, it's just hard to follow them. But the idea is when you train your immune system in the right way, you actually make blocking antibodies. And those antibodies should stick with you for life. It's just the way that the immune system works. So it's been a really fun thing for us. I personally had a cat allergy. And so that's how I got into this. When I was in my surgical residency, I did not have the time to do allergy shots because when you're a surgeon and you're working hard in your training, you're working 100 hours a week and you don't have time to go get a shot every week. But one of my mentors was like, oh, well, they do this thing over in Europe where you can just take these drops and it works the same way. And it sort of blew my mind. I was like, how come this isn't like what I was offered? I'm a doctor and nobody told me. And a lot of it, unfortunately, is just due to the constraints of our healthcare system, right? The reimbursement is high with insurance for allergy shots. And for drops, they're not covered. And so I think most of my colleagues, they're like, well, we can only offer what insurance covers. I think I just had to make that mental break of like, look, if there's a better treatment, we should give people the option of taking it, even if their insurance isn't covered. The insurance companies are not the arbiter of your health. It is between you and the person you choose to trust. And that's what we're all about.
Yeah, that's awesome. I myself still suffer from pet dander and
Yeah.
pretty much all animals. And I just,
Well,
no, I should, but the easy way is just don't be around them.
Right. Of
So-
course. And that works for cats and dogs. What do you do about grass? What do you do
Yeah.
about pets? What do you do about dust and mold? These are things you can't not be around them. And so I think it's better, instead of just having your immune system constantly in an inflamed environment, it's just better to get tested. And if you're a candidate, get treated.
Yeah.
I think most people just don't even know this exists. That's the biggest problem.
Yeah. And then, like I said, I feel whatever my diet, where I'm living, I've grown out of a lot of environmental allergies, the
Yep.
ones that really hit, but that's not to say that I'm not getting hit by low levels of stuff. And I'm just not knowing why my sleep sucks. I'm tired. There's so many things that could be wrong with our bodies. I would love to at least check it again and see like what's on the list now. And if there is some kind of, like you're saying, immunotherapy to help edge that off. Basically, within our family, my daughter wants like a dog or a cat, and I can't. I'd just be miserable 24/7. But
And we're in Denver, where a lot of patients, probably similar to the patients that listen to your podcast, are where people are looking for that edge. They're trying to get that hack to improve their health. And so again, in my training, a lot of the patients I treated for allergies are people who are like, oh man, every spring is awful. I'm sneezing and I'm miserable. And certainly those patients absolutely should consider allergy treatment. But one thing that's been really cool at Denver is there's patients who are runners, cyclists, marathoners, climbers. These are people that are just trying to get that little edge. And they're like, hey, how can I improve my wellness and sleep? And even these patients are like, look, I'm bothered enough by the allergies that I want to seek treatment. And so we've had a really good experience working with what we call these health optimizers, people who really want to value their health and are willing to push a little bit harder. And it's better to retrain your immune system than to try to take a bunch of things that maybe don't work.
Yeah. Like going with the environmental allergies, say you don't mind the sneezing, you can control it a little bit with maybe Claritin or something like that, and they don't think it's like that big of a deal. Stay away from animals like I'm doing. How is that, even if you're just at a low level, you're constantly getting hit? You mentioned sleep being a big deal, which in my over 40 audience is huge, but is there any other inflammatory factors to, if you're having environmental allergies, is there other systems in your body that are getting affected by it, like your digestion and all that kind of stuff?
Yeah, so let's talk about this. And I'm going to bring up a model for those watching on video, and I'll explain it for those listening at home. We have this concept that we think about in healthcare or in ENT called the unified airway theory. And it's basically this idea that from the tip of your nose, where the air goes in your nose, all the way through your nose, through the back of your throat where it goes down, and then into your windpipe, all the way down to your lungs to where oxygen is absorbed. That is one organ system, right? It's essentially the entire point of this pipe is to get air from the outside and oxygen into your bloodstream so your muscles can use it and your body can use it for energy. And so anything that affects one part can affect the rest.
Mm.
And so what we see is people who have environmental allergies, it's not just sleep apnea. It causes chronic sinus infections. It causes postnasal drip that irritates their windpipe. And so some of these patients end up with a cough or constant like throat clearing. Those allergens get stuck in the mucus and they irritate things and they drip down to your lungs and they can cause asthma attacks or respiratory disease. And so we call this the unified airway theory. It's the idea that anything that affects one area is going to affect the rest. And so fixing the root cause right where air first comes in can improve your sleep. It can decrease your risk of getting chronic sinus infections. It can decrease asthma. In kids, it can affect what we call dentofacial abnormalities, right? If kids are not breathing well through their nose, they're breathing through their mouth at night and their teeth actually grow in inappropriate ways. They end up with braces and their teeth are crooked. They get more cavities. And so we call those dentofacial abnormalities. They can even get what we call allergic shiners and just like their body doesn't develop well. And then even in kids, what's really interesting is your nose is connected to your eustachian tube and your eustachian tube connects up to your ears. And so there is data that suggests that people with chronic allergies, it can affect their eustachian tube function and lead to ear infections. And so kids are getting these ear tubes and ear infections all the time. Again, the key is to figure out what is the root cause of that and can you fix it? And so a lot of this, I think the idea is like get the data, figure out what the root cause of your issues are and treat those causes so you can live healthier.
Yeah, no, that's awesome.